chemical abortion, mag-iit ka ng pill, papalatla. Chemotherapy, contraceptive pills, which prevent implantation. Surgical abortion, and yung ginagawa sa ng mga ilog. These are the different needs. So, ang problema kasi, Williams defined young pregnancy at the start of conception, and Williams changed the definition from fertilization to implantation. If you're going to look at the technical definition. So this is what was done in the 1960s. In the 1960s, they made the Immunology Bulletin at the ACOG and FICO. And this is how they define these terms. Fertilization, nag-unite. Conception is implantation, which is totally different from what we already understood before. When we say fertilization and conception, in the normal parlance, these are identical terms. Diba? Conception and fertilization. But in your technical books, Williams, pregnancy is conception or implantation. So, meron siyang implication. Kasi sinabi, abortion is termination of pregnancy. So, ibig sabihin, pag abortion sa kanila, abortion just starts out pagka nag-implant na siya. But what we believe is that, what we know, that life begins at fertilization. So, buhay na yun even before. So, implication to kasi pag nilagyan natin kung paano ba nag-work ang IUDs and contraceptive pills, you will see the implication of using these terminologies. Your textbook says, Tatsum also says the same thing, and it even says that the other mechanisms of action are the major mechanisms of action in preventing pregnancies when ovulation does not occur. So, ovulation does not, hindi siya talagang, hindi siya 100% nangyari. And the other mechanisms of action provide the mechanism for preventing a pregnancy. So if you're going to go to the technical terms, anything that will prevent implantation is technically abortifacient. Tama ba ako? Tama, di ba? That is what science says. If you believe that life is at fertilization. Pero kaya sinasabi ng World Health and the other medical organizations na hindi abortifacient kasi ang definition nila, conception is implantation. Pero kung naniniwala tayo that human development begins at fertilization, anything that will prevent implantation terminates life. That is the simple, logical, scientific fact. Diba? Yun lang naman yung kailangan natin Kailangan natin yung alam mo. And these are just medical journals, latest medical journals. We just show you what it says. So kung susundan natin yung definition of FIGO and World Health Organization, technically, hindi ka pa nag-abort. Pagka sinabi, pero kasi paniniwala nila that life begins at implantation. But if you believe that life begins at fertilization, then ayoko lang kayo sunduin yung intelligence ninyo. Diba? Kasi you can't start something that hasn't started yet. You can't end something that hasn't started. But if you believe that life begins at fertilization, then anything that prevents implantation will prevent life. That is abortion. That is the abortifacient effect. While it may be argued that it's not the primary mechanism of action, it happens nonetheless. The problem is wala tayong logistics and ethics enough to see which successful prevention of pregnancy is a result of these different mechanisms of action. Alam naman, lahat ng sperms na natin, bakit na natin mag-fertilize siya. O hindi natin lahat ng men's ng nanay, hindi na natin kung may ma-fertilize na egg doon. Hindi natin magagawa yun. Hindi natin pwedeng gawin na okay na naman mag-sex tayo tonight tapos hindi na natin kung magpupulis na o hindi after 2 days. Ethically and logistically, we can do that. So, but if you want to respect life and protect life, you do not put life at risk. That's why, even if it happens in a small number of patients, ovulation can occur, fertilization can occur, life can begin, and prevention implantation will terminate life. That is the scientific fact. Hormonal contraceptives have a failure rate of 0.1%, a perfect use, and as 0.7.6, some 10% typical use failure rate. What this means is that for every 100 people, there 7.6 of who use contraceptives will fail. So that's just like saying, I'll give you airplane ticket to the United States, all expense paid, but one of the airplanes will crash. So that's what it means. So for us who want to take care of our patients, do we want to put our patients at risk? Because certainly I will not ride an airplane that will crash. This is a failure rate. It means that it happens. So that is the difference between efficacy rate and on the other. So even if maraming na-prevent, kung pag dinagay mo yung maraming na-pills, ibig sabihin nun, madami yung mag-prevent, marami rin yung mag-prevent, mag-plan. And there are thousands, even millions of lives that are just flushed down the toilet or thrown in the sanitary napkins. So we should use, sabi ni Rizal Tiveros Barakel, original is pro-chance. So for me, what about the chance of the embryo to fully implant on the endometrium? The chance to have a life. Because if you give these drugs, you're preventing the chance of life to begin for this person to be born into this world and to give changes, to cure cancer, to teach people to live well. So I hope we give everyone a chance. And chance starts at the start, at life. So I hope you respect that. What are the adverse effects of the pill? These are scientific facts. It is a chance to get cancer, whether cervical or breast cancer, thrombosis, a chance to get ovarian abscesses from your IUDs, a chance to get osteoporosis from your depo-provera. You can count for your contraceptives, you can cause thrombosis. I'll just flash to you some of the journals. Kasi sinasabi ni Secretary Cabral, hindi ito nagkakos ng cancer. Na we can reduce, of course, we can reduce ovarian and endometrial cancer, but you will cause breast and cervical cancer. So in the end, may cancer ka pa rin. Whether you use it or not, so deads ka pa rin. Pagka nag-take ka ng pills. And pinasabi lahat naman ng pills, lahat naman ng gamot may adverse effects. Paracetamol. Pero ito, cancer. At ito, you take it for years, months, years. And this is not the same if you take paracetamol, you take 3 days, 4 days. These are drugs that you give your patients for years and months on end. And you put your patients at risk. So if we say that we do no harm to our patients, are we doing no harm to our patients by just having all these things? It can cause strokes in children. And these are local and international studies.
Scientific.
We have actually a local study on the increase of breast cancer incidence in patients who are taking hormone replacement therapy and for patients who are taking all of the pills. For early onset, for those who took pills early in their reproductive years, they can have early onset breast cancer. Your UP Manila study says that. Mayo Clinic also says that. And even the World Health Organization says that your oral contraceptive pills are class 1 carcinogens. Here, International Agency for Research on Cancer says that these are carcinogenic. What about cervical cancer? Cervical cancer is also increased because it potentiates the action of estrogen. Remember, uncontrolled unopposed estrogen increases the risk of cervical cancer and breast cancer. That's what we learned in obstetrics and gynecology. So kaya nga diba yung mga hindi nabubuntis, sila yung mas mataas yung risk na magkaroon ng breast cancer. Kasi uncontrolled unopposed estrogen. So the IRC, International Agency for the Research on Cancer, this is what it says here. These are class 1 carcinogens. So it's proven that they can cause cancer. Ang problem natin, mayroong mga advocacy groups that say that pills and contraceptive pills will cause cancer. That is totally scientifically untrue. So in the end, what will happen if you take your pills? Pills are nakamamatay. So I hope you don't put your patients at risk and you give out medicines. Yung depo-provera, do you know that depo-provera is being used in the United States for sex offenders to prevent their urges? But Pfizer in the United States is being sued with $700 million because of osteoporosis in women patients in their 20s. Who do injectable depo-provera. And this is what the injectables are. This is what they will want to give to our children, to your friends, to your aunties, to your cousins. What about the IUD? The IUD is primarily a spermicidal because it will cause an inflammatory action on the endometrium, so mamamaga siya. Mamamatay yung sperm, pero yung mga nakalusot, hindi naman namamatay lahat din. So, may makakalusot doon. Ang mechanism na pag na-fertilize, pinaprevent niya na mag-implant kasi magana nga yung endometrium. So aside from preventing implantation, it can also cause an increase in infection because it is an inflammatory state. It increases the risk of these patients na magkaroon ng ascending infections, actinomycosis, and other ovarian abscesses. So there's the American Journal of Obstetrics and Gynecology says that it has a pre- and post-fertilization effect. That is the scientific fact. So what are the harm that IVs can bring? It can penetrate your organs because IV is hard and your uterus are small. So it can penetrate your uterus and it can go to your rectum, it can go to your bladder. It can cause stones pag na-perforate siya sa bladder, tapos magkakaroon ka ng stones. Pag-perform kasi naitus siya, di ba? So pwede mangyari yan. Bladder stones, LLDs. IUD na abdominal mass. Kawawa nga siya, may mass na nga siya, tapos nabusok pa ng IUD yung mass niya. But any other things that can happen? Well, I'm just showing you these pictures to show you that these are real dangers for your patients. And as part of informed choice, I hope you also inform your patients about all of these things. Because actinomycosis, pseudomonas infections. So are these devices medically safe for our patients? What if a woman gets pregnant with an IUD? So anong gagawin? So pwedeng mabuti siya, or it also increases the risk of miscarriage. So pwedeng ma-abort pagka nabuti siya. So this only proves that mayroong post-fertilization effect at pwede magkaroon ng fertilization with your IUDs. At pag yung IUD doon, niliris mo yung nanay at yung bata. Kasi pwede mag-preterm at pwede rin siyang mag-abort. Yung lahat bata mamatay, yung nanay pwede rin mamatay.